News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello, I'm Tom Lavin. Welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. We have a good show for you today. In the last two segments, we're going to be talking with Lindsay Fletcher from the University of Nevada Department of Psychology about how she uses acceptance and commitment therapy with people who have weight problems. However, in the first two segments, we're going to be talking with Dr. Barbara Kohlenberg, and Dr. Kohlenberg is with the Department of Psychiatry at the University of Nevada School of Medicine. And Dr. Kohlenberg, thank you so much for being here today.
Thank you so much for inviting me.
Yeah. And Dr. Kohlenberg is an expert in the application of acceptance with substance abuse and with stigma. And so I guess, Barbara, the first thing I'd like to ask you is, can you talk with us a little bit about how acceptance can be a therapy in working with substance abusers?
Sure, I'd be happy to. I think the first thing I'd like to do is talk just a little bit about some of the assumptions that we make when we are working with people with substance abuse problems. And the first is really that human beings in general, not just people who have addiction problems, but human beings in general suffer a tremendous amount. There's a huge amount of pain that we all have really on a daily basis, all the time. And when people have substance abuse problems, they've really discovered a way to use a substance to help them feel better and to help them not feel pain. And so many of the treatments for substance abuse problems have really involved sort of collaborating with people on helping them not feel pain. So a lot of treatments for smoking cessation involve giving medications to help people not want to smoke. Many of the medications, many of the therapies are really involving helping people not feel the pain that normally produces the desire to use. And the problem is that this hasn't worked very well, either with smoking, any kind of polysubstance abuse, alcohol, just doesn't really work very well. So our treatment, which is based on acceptance and commitment therapy, is a treatment that's really about helping people have the pain and suffering that they have and make choices to live in the moment, to head in a cherished direction in their life with their pain, not having to use in effort to suppress how awful they really feel. Mm-hmm. So the use of acceptance in treating people with substance abuse disorder or substance use disorders is really about helping people change their relationship with their painful thoughts and feelings. We're not trying to help them change their thoughts and feelings. This is kind of revolutionary.
Yes, it is.
Yeah.
It is. And so because a lot of people, lay people as well as therapists will say, just find new ways of feeling good and that'll take care of the problem. But I guess
Absolutely.
You're saying people need to actually walk through the pain.
Absolutely. I would say that that 99% of the time when I interview a new patient and who is struggling with anything from heroin to alcohol to smoking, and I say, how can I help you? 99% of the time they will say, help me stop wanting to use. And then I have to say, I'm really sorry, but I can't help you stop wanting to use. But I can help you want to use and choose not to use. I can help you have compassion for your own desire to kind of satisfy that craving. But I can't really help that craving go away because we just really don't know how to do that. And even if we could do it, it'll show up again in the future. We know that for sure with smoking, for example. We know that people can get through physiological withdrawals in a few weeks, but yet a smoking relapse can occur years later. So we know that it's not really that the craving goes away forever. It comes back, and then you have to learn how to hold that craving with some compassion and kindness and engage in some other sort of behavior that has meaning. Make a nice dinner, go to your kid's baseball game, take a walk, take a bath, call a friend.
So are you saying, Barbara, that you encourage or coach or facilitate people in feeling these feelings, the desire to use or feeling their sadness or their grief
Absolutely.
or their shame, all those
Absolutely.
triggers.
We feel that it's very much the case that people use substances in order to become smaller, in order to help reduce the pain that they're feeling that's making them want to use. So if somebody is grieving, if somebody is bored, if somebody is angry, they may use in order to attenuate or make smaller those sorts of feelings. And we really believe that in the effort to sort of promote wholeness and health and vital, cherished living, that we don't want to help people become smaller. We want to help people become bigger.
Mm-hmm.
So we want to help people feel what there is to feel in life, whether that's tremendous grief or tremendous joy, to feel it and to not have to take the edge off, but to feel it, hold it, walk with it, and take care of business in life, whatever that business is for that particular person.
So in this last minute, do people then need to find courage to face these feelings that they've run away from or tried to make smaller for so many years?
I think finding courage is a really nice way to put it. I also like to think of it as sort of an interest, that when one has compassion for one's own suffering, that suffering changes. So rather than the courage to fight that suffering, I wouldn't put it that way. I would more say to have, to discover the compassion to put your arms around your own suffering.
Well, that is interesting, and when we return after this brief break, we want to hear more from Dr. Kohlenberg about these concepts. Hello, and welcome back to New Skills for Living. We're talking with Dr. Barbara Kohlenberg about the important role of compassion in addressing substance abuse. And Barbara, I found that so interesting. Would you please follow up with that, this idea of compassion?
Sure. I'm really interested in the term compassion, and sometimes when I'm interested in a concept, I will go to the Oxford English Dictionary and look up what that means. And what the word compassion means is really to do something with pain. It's compassion with pain. And to me, that's a really interesting concept, or it's really interesting to break the word down in that way, because what that tells me is that when you're compassionate to yourself or you're compassionate to somebody else, it's not just about being nice or doing something that's easy to do or fun to do. It can really involve doing something that's very, very painful to do. So when you think about, for example, a physician who gives compassionate care, that means the physician does something for a patient even though it may be very painful for that doctor to do it. It might feel bad to give bad news, for example. In the area of substance abuse, I'm interested in compassion both from the point of view of the practitioner who has to walk into sometimes very painful situations with their patients, in the sense of people that are very ill, people that are struggling tremendously, and be there with them, and it may hurt very much. See people fail, see people relapse, kind of get right next to it and kind of walk through it with them. When it comes to somebody with a substance abuse problem, I think that it becomes second nature for that person to be very punitive to themselves for the mistakes they've made in life, for the screw-ups, for the feelings that they have that they think that they're not supposed to have. And I think people with substance abuse problems are masters in our culture at punishing themselves and trying to get rid of that level of pain. So when I talk about being compassionate to oneself, it involves a lot of acceptance and mindfulness, which are concepts I think we'll cover a little later. But it involves being able to get close to your own pain, which is painful, and shake hands with it, and put your arm around it, and see how it changes, and see how you can take it with you as you head toward, head in directions in life that are meaningful and that one cherishes.
So are you kind of saying, like, you know, the medieval spiritual directors would talk about embracing the dragon, not running away from it, but embracing it, and then it kind of dissolves and or you integrate that into your life. Can you talk a little bit more about this then, please?
I love the concept of embracing the dragon. I don't use that
Yeah.
term, but I really know what you mean, and I like that concept. I say absolutely. It's about looking at some of the darkest parts of yourself and befriending that part, getting to know that part. I don't know that it dissolves, but I know from experience in my own life and in the lives of many of my patients that it changes when it's when you leave an adversarial relationship with yourself and you develop a friendship with yourself. Those parts of yourself that you're struggling with change. They never go away, I don't think, but they do change.
So I'm wondering, as you're talking about this, I mean, like from a Jungian perspective, in terms of like embracing the dark side, and if we don't, then it begins to rule our lives. When you're talking about compassion for those parts of ourselves, is that what you're also referencing from an ACT perspective?
Absolutely, yes. It's very much about when a dark part of oneself sees the light of day, its power changes. It doesn't go away, but it's different than when you're running away from it, when you're in battle against it.
Well, that was some excellent information. We need to ask you to come back
Okay.
so we can talk more about this idea of compassion with ourselves as well as with others. We're going to be joined by Lindsay Fletcher right after this brief break, and we want to thank Dr. Kohlenberg for coming and sharing her wisdom and expertise with us.
Thank you very much.
Thank you. Hello, and welcome back to New Skills for Living. We're talking with Lindsay Fletcher with the University of Nevada Department of Psychology. And Lindsay, thank you so much for being here today.
Thank you so much for having me.
And Lindsay's going to talk with us about using acceptance and commitment therapy with people who have weight problems. And I guess the first thing that I want to ask you, Lindsay, is how does this approach differ from other approaches?
Okay. So most of the traditional approaches, at least in the realm of psychology, really focus on how to help people control how they think in order to change what they're doing in terms of their weight loss behaviors.
Okay.
So with acceptance and commitment therapy, what we focus on instead is how to help people relate to their thoughts and their feelings differently. So in a way that's much more accepting, and as Barbara spoke about so beautifully, really in a compassionate way. So that we don't need to change how a person is thinking about themselves or about food or about exercise first in order to change how they, what they do. That they can actually change how they relate to those thoughts and feelings without changing them, and then change their behavior in the service of what it is they're wanting to create in their life.
Okay, now, Lindsay, I know this could be a hard question, but can you give us like an example of like maybe the one type of cognitive therapy or change your thoughts, how a therapist from that paradigm would approach it, and then how ACT would approach that very same thought?
Sure.
Okay.
Okay. So if you take the example of someone who is an emotional eater, which probably a lot of people can relate to that. So that person might say, you know, I really want to change how I'm eating and what I'm eating, but I have so many urges. And because of these urges, I just can't seem to change my eating habits. So a cognitive therapist might say, well, we need to really look at your beliefs about food and try to change what you're thinking and show that your beliefs are not, in fact, true and provide evidence to the contrary.
Okay.
However, in an ACT approach, we would say, well, you're going to have these urges, that these urges don't have to control what you eat or don't eat, that you can actually learn to urge surf, so to speak, and allow yourself to feel the urge and everything that may be underneath it, such as loneliness, sadness, boredom, whatever it is that drives that particular person to want to overeat.
Okay, and so to go ahead and kind of like feel that feeling and it will pass, Lindsay, and then get oriented toward action or toward a valued goal or behavior?
That's right. So to really help people notice that their thoughts and their feelings and their physical sensations as well are passing events, that they come and they go, and because of this, they don't need to have the kind of control over their behavior that we often believe that they do.
Okay. Well, I would imagine clients that you work with, when they hear you framing their weight issue or their eating issue in this way, I would imagine they experience that as kind of a freeing experience for them. Is that what you experience as a therapist, that that's what your clients are telling you?
That's often the case because clients have so much experience with trying to control these urges in the case of emotional eating, with trying to control how they're thinking, for example, controlling the motivation, for example. You know, I often hear people say, well, I just don't feel motivated. So it's another area where they try to control how they're feeling before making the behavior change. And they know from experience that doesn't work.
Yes.
You know, I often ask people, so what happens when you truly try to fight with this urge? And they'll tell me right away, well, it doesn't work. Actually, it often makes it worse.
Yeah. And then we need to be wrapping up now, but I would imagine, we'll touch base with you after this brief break, but I would imagine people experience themselves as failures then when they're not able to do that, but you're opening up a new way for them, which we'll get to right after this brief break. We'll see you in a minute. Hello and welcome back. We're talking with Lindsay Fletcher from the University of Nevada Department of Psychology. As we're getting ready for this next segment, though, I do want to mention to you that probably the director now is pulling up the EAS-EAP website. And on that website, you'll be able to view this show as well as other shows that might be of interest to you that we've had here on Channel 8 in the last year. So if you'll go to that website, you'll be able to watch this show as well as the others. And so now to talk with Lindsay. Lindsay, you had spoken earlier about the importance of values in addressing this issue with people. Can you tell us more about that, please?
Sure, absolutely. Okay. So often people who want to lose weight are really focused on a particular weight, a goal weight that they want to achieve. And it can be very easy to become narrow in their attention in focusing on that particular number. However, I like to take a step back with clients and really ask, what's really important to them about losing weight? And often it's about living a healthy life. And living that healthy life could be about reaching old age with a partner. It could be about seeing a grandchild graduate from college or spending really quality time with the people that they care about most. So there are these larger values which really aren't goals. They're not things that you achieve. And so weight I like to think of it as like a signpost along the way. So if you're heading in a particular direction, and that direction is in the direction of what you most cherish, then you have these signposts like a particular weight, like a particular dress size. These things, not to say that they're not important, but they're just one of so many things to pay attention to.
So it's part of a larger life.
Absolutely.
Yeah. Now, I'm wondering, though, you know, there are these ads on television that will say you've got your 20-year reunion coming up, and you can drop 40 pounds in 6 weeks. And so people want to drop 40 pounds in 6 weeks.
Yep.
So how do you kind of reorient them in a way that is truly effective based on your research?
So when you have a particular goal like that, I mean, so many people go through yo-yo dieting where you can lose the weight. And in fact, there are many different ways people can lose weight quickly, and the key is actually keeping it off. That something like 95% of people who lose weight actually will regain it within 5 years. So if you have a singular goal like that in mind, that's a perfect setup for being someone who's going to be on a roller coaster like that. So we would want to talk about, well, this reunion may be important. What else is important in your life? What other reasons would you have for wanting to lose weight? Is that part of wanting to live a healthy lifestyle? And if someone's thinking of it as a diet, they're already setting themselves up because the word diet implies at some point going off of it. So we like to talk much more about a lifestyle.
So I'm wondering, in acceptance and commitment therapy, Lindsay, is it appropriate with that type of therapy to begin to say, well, let's take a look at why it's so important to you to look good at your reunion? Do you explore that, or is that not part of the therapy?
Sure, you could explore that.
You might.
I think the more things there are that motivate a person, the better. So I wouldn't invalidate that that person might want to look good at their reunion. That's a perfectly reasonable thing to strive for. I would just worry if that was the only thing that they were paying attention to, that it could be one of so many valuable goals, again, that could help them move in a particular direction. Although if that goal was taking them in a direction other than what's really important to them, then sure, we might want to look at what's gonna be consistent with living a full life.
Okay. So what I'm wondering is, so along with looking at values, probably there are values that is urging them to say, I want to look a certain way when I go back to my reunion. Like, people used to laugh at me, or I want this particular man or woman to be attracted to me when I go back there. Do you kind of explore that and tap into those values?
Sure. So, I mean, in this scenario that you're bringing to light, I would start to wonder, is there something that they're also avoiding?
Okay.
Are they avoiding an experience of repeating an experience of shame from their childhood? And if that's the case, I would just want to look more closely again at whether that's really getting them closer to a fuller life or one that's more narrow.
Okay. That makes a lot of sense. I guess in just 30 seconds, for someone who's watching our program and they have a weight issue, what would you want to say to them in 30 seconds?
That, oh man, 30 seconds.
Yeah, it's hard, I know.
I think the most important thing is to really think of these changes as really a lifestyle change, and that it's a process also of moving forward, and that if you find yourself heading off of the path that you want to be on, it's a simple turn to come back to the values that are most important to you, and that weight is not the only factor.
Excellent, Lindsay. So we want to thank Lindsay Fletcher for being with us, and earlier Dr. Barbara Kohlenberg. Again, these shows are available online. Thank you for joining us.